They either walked, ran, or bicycled at a high intensity, meaning between 85 to 95% of peak heart rate for 4 minutes. They then recovered by doing moderate intensity exercise for 3 minutes, and they did this 4 times for a total of 28 minutes. The HIIT exercise that they were doing was supervised. They were also encouraged to do cardio intervals on their own. This group was being compared to another group of people who had stable coronary artery disease. And this second group, they were just encouraged to follow the standard cardiac rehab moderate intensity physical activity guidelines. So we're comparing one group that did HIIT exercises twice a week, and we're also encouraged to do cardio intervals on their own, compared to a group that was just doing moderate intensity physical activity following standard guidelines all on their own. At the end of the 6 months, the lipid content in those plaques were reduced in both groups by 13 to 14%. So both HIIT exercise and moderate intensity physical activity were effective in reducing the lipid content in these plaques. Now, the HIIT group did improve their aerobic fitness to a higher degree, a little more than double that of the moderate intensity group. And when they looked at both groups combined, they saw a trend. The more the aerobic fitness increased, the more the lipid content in those plaques reduced. With the limited evidence that we have right now, the main take-home message is just get people moving and doing things that they enjoy doing that they'll continue doing on a regular basis. It is important to point out that 92% of the participants in this study were men, so we don't know if exercise affects women differently in terms of reducing lipid content in plaques. And as I mentioned earlier, people with coronary artery disease who are just starting an exercise program or are wanting to increase the intensity of their program, they should be clinically supervised. HIIT can bring many benefits, but there's also an element of risk that needs to be managed. And so it's really important that you discuss this with your doctor if you're wanting to increase your intensity. One example of the risk is one person in the study, they did experience angina, which is chest pain associated with coronary artery disease, and they did have to undergo coronary artery bypass surgery. This is one reason that I consistently mention throughout my channel the importance of discussing any changes to your exercise program with your doctor if you have chronic conditions like diabetes or coronary artery disease. If you're ready to start tackling that plaque and reducing your risk for heart disease, have a conversation with your doctor. Thanks for watching.